What's up? Medita here. Let's talk about the anatomy of the respiratory system. In this segment, we will be talking about the anatomy of the lungs and the pleura. So the respiratory system consists of all the organs involved in breathing. These are the nasal cavity, the pharynx, the larynx, the trachea, the bronchi, and the lungs. Now, let's look detailed into the anatomy of the lungs. So in this video, we're first going to go through the functions of the lungs. Then we're going to go through the parts and the surfaces and the margins of the lungs. After that, we will look at how the right and the left lung are divided into lobes and segments. When we're done with the lungs, we will go through the pleura, which is the coverings of the lungs. We will go through its parts and its recesses, and then lastly finish up by looking at the mediastinum, basically what's between the right and the left lung. Now, the lungs are the primary organ in the respiratory system because it's the essential organ of respiration. But it doesn't work alone. We have muscles called muscles of inspiration, which aid in expanding the thoracic cavity to further decrease the pressure so that air can come in. And examples of those are the diaphragm and the external intercostal muscles, as well as some accessory muscles of inspiration like the sternocleidomastoideus. Similarly, there are muscles that aid with expiration. And even though this process happens passively due to the recoil system, the internal intercostal muscles and the abdominal muscles are examples of muscles that aid with expiration. So let's first have a basic understanding of the functional unit of the lungs. Now, when you look at the lung microscopically, you will be able to see the alveolar sacs. And these alveolar sacs are what we refer to as the functional unit of the lungs because they give it its function. So, if you zoom in into one alveolus, you will see that they're highly vascularized so that oxygen can get into the bloodstream and waste products like carbon dioxide can get excreted out through diffusion. So that was a quick introduction of how the lungs primarily function. Now let's start with the anatomy by looking at the parts and the surfaces of the lungs. The uppermost cone-shaped part is what we call the apex of the lungs, and the bottom is what we call the base of the lungs. The lung faces different structures, right? And because they face different structures, we divide the lung into different surfaces as well. So the lungs have 4 surfaces in total. The first surface we're going to have is the costal surface, which is directed towards the ribs, as you see here. So this whole surface, which is covered by the ribs, is what we refer to as the costal surface. Below the lungs, you will find a perfectly drawn diaphragm, which means that the bottom surface is called the diaphragmatic surface. Between the lungs, you'll find a space filled with structure called the mediastinum. So this is the mediastinal surface. Now the mediastinal surface is very important because this is the surface where you'll find the hilum of the lung. Think of the hilum as an entrance or a hallway which leads into the lungs. And this entrance is bordered by the pulmonary ligament. And all structures that come in and go out from the lungs are called the root of the lung. And here's an image that I really liked from the book Snell's Clinical Anatomy. The reason why I liked it is because it perfectly shows how the hilum of the lung look like. You see, it's kind of a depression or a hallway that leads into the lung, bordered by the pulmonary ligament, and structures go in and out as the root of the lung. And there are actually special arrangements that make the right lung differ from the left lung. In the right lung, the highest structure which enters the lung is the bronchus. Below the bronchus is the pulmonary arteries. Then there are the pulmonary veins. On the root of the left lung, the highest structure here is going to be the pulmonary artery. Then there's the bronchus, and below that there are the pulmonary veins. And there's a mnemonic you can use if you need to know this arrangement that goes bright is right, where B stands for bronchus, just to remember that the right lung is where the bronchus is the highest structure. So that was the mediastinal surface. The last surface is located between each lobe of the lungs, called the interlobar surface, which are very small surfaces that indicate the separation between the lobes. So that was all for the surfaces. Now let's do the margins of the lungs. Now each lung has 2 margins. The inferior margin is thin and sharp, and it separates the costal and the mediastinal surface from the diaphragmatic surface. The other margin we have is the vertical one, called the anterior margin. And as you see here, the anterior margin on both lungs are different. On the right lung, it's almost vertical, but the anterior margin on the left lung is not. And it kind of makes sense if you think about it, because remember, the heart is in the middle, but the apex of the heart is directed towards the left, which forms the cardiac notch on the left lung. And this cardiac notch is limited by a thin slip of pulmonary tissue called the lingua of the left lung. And that is because the vertical margin of the left lung is not as vertical as the right lung. Now, anatomically and functionally, the lungs are divided into lobes. So here's a lateral view of both lungs. The lobes are limited by this groove called the oblique fissure. It goes obliquely down and it exists on both lungs. But the right lung has an extra fissure that goes horizontally called the horizontal fissure. These fissures are important because they divide the lungs into the superior lobe, an inferior lobe, and a middle lobe. Only the right lung has a middle lobe. And each lung is further subdivided into segments. And think about it, why is it important to subdivide the lungs into segments? Imagine there are tumors, granulomas, or any indication that may require you to surgically remove a part of the lung. Based on the knowledge you have about the lobes of the lungs, you can actually remove segments without harming the other segments in the same lobe, because each lobe has its own supply of bronchi and blood vessels, and then each segment has their own bronchiolar branches that further divide into alveolar branches. So that's really the whole idea of lobes and segments. Now let's go through the segments on the right lung first and then do the left lung. So the right lung again has a superior, middle, and an inferior lobe. And the whole lung is divided into 10 segments in total. 3 segments for the superior lobe, 2 segments in the middle lobe, and 5 segments in the inferior lobe. And to look at all those segments in a little more detail, we need to look at the right lung both laterally and medially. And again, there's the superior lobe, middle lobe, and inferior lobe with the hilum of the lung here. The superior lobe can be divided into the apical segment, posterior segment, and the anterior segment. The middle lobe can be divided into the lateral and the medial segments. The inferior lobe can be divided into the superior segment, basal medial, basal anterior, basal lateral, and the basal posterior segment. So that is the segments of the right lung. The left lung, remember, consists of the superior lobe and the inferior lobe, and they are divided into a total of 8 segments, not 10 like the right lobe. There are some variations here. In some people, some segments might be fused and form 8 segments, and in some people, there might be 9 segments, and I'll show you the differences as we go through them. So the superior lobe consists of the apico-posterior segment, anterior segment, superior lingual, and inferior lingual segments. The inferior lobe is divided into the superior segment, basal anterior, basal lateral, and basal posterior segment, giving a total of 8 segments. In some people, the basal anterior is divided into the basal anterior and the basal medial segments, adding a total of 9 segments. So that was it for the anatomy of the lungs. Now let's do the pleura. The pleura is the coverings of the lungs, and we have 2 different types of pleuras around the lungs. The innermost pleura is called the visceral pleura, which is in direct contact with the lungs. Externally to that, you will find the parietal pleura, which is in contact with all surrounding structures. And since it's in contact with different structures, we also divide it into parts, just like we did with the lungs in the beginning of this video. We have the costal part, which is in contact with the ribs. There's the diaphragmatic part towards the diaphragm. There's the mediastinal part towards the mediastinum. And then there's the pleural cupola, which is where the parietal pleura covers the apex of the lungs. Now, as you study the coverings of the lungs, you will see that the visceral and the parietal pleura meet at a certain point. And here's a schematic picture that I made to visualize it. Here's the trachea and the bronchi, and around the lungs you will see the visceral pleura in green and the parietal pleura in orange, with a perfectly drawn diaphragm down here. So again, there's a point where the visceral pleura and the parietal pleura meet, and that point is here at the hilum of the lung. And when they meet, they form a covering around all structures that make up the root of the lung. And as they do that, they form a double layer of pleura, which form the so-called pulmonary ligament we talked about earlier. Makes a little more sense now, right? So again, the pulmonary ligament is formed by a double layer of pleura. So that is the visceral and the parietal pleura. Now, between these two, there's a cavity called the pleural cavity. And that cavity is filled with serous fluid that function as a lubricant that reduces friction because the lungs are constantly expanding and deflating. One last thing we need to cover in order to understand the complete anatomy of the pleura are the so-called pleural recesses, where a recess means a narrow space. So the first space is the costal diaphragmatic recess, which is the biggest recess we have in our pleural cavity. Just keep in mind that all structures I pinpoint goes for both lungs. And then we have the costal mediastinal recess, which lies right behind the sternum. And then we have the vertebro-mediastinal recess in front of the vertebral column between the costal surface and the mediastinal surface. And then the last surface is the phrenico-mediastinal recess. And this recess lies only on the left side between the diaphragmatic surface and the mediastinal surface. So that's all for the pleura. Now, the last thing I want to talk about in this video is the mediastinum. The mediastinum is the area between the lungs filled with structures. Let's now make a vertical cut right about here and look at the mediastinum from this perspective, where we'll see this. And just for orientation, here we have the sternum and the diaphragm here with the central tendinous part in red and the muscular part in orange. The mediastinum is generally divided into two regions. We have the superior mediastinum and the inferior mediastinum. But the inferior mediastinum is further divided into three regions. It's divided into the anterior, middle, and posterior mediastinum. And each of them contains specific structures, whether we're talking about specific organs or arteries or nerves. For example, the superior mediastinum will consist of the esophagus, the trachea, thymus, and many blood vessels and nerves. The anterior mediastinum consists of many blood vessels, as well as possibly a part of the pericardium. The middle part consists of the heart and the pericardium, and the posterior part will also consist of many blood vessels and nerves, as well as the esophagus. And with that, my friends, we're done with the anatomy of the respiratory system. If you found this video helpful, please put a like, share, comment, whatever you find convenient to you. See you next time.